Hello, today we'll be going over the homeless community and the hepatitis B vaccination. My name is emilystaley. I'm at Indiana State University doing the LPN to BSN program. This is for my community health nursing class for my health education project number 6. Learning objectives. Upon completion of this presentation, the viewer will be able to define what is hepatitis B, explain when the hepatitis B vaccine is given, list 3 ways the hepatitis B virus is spread, state 3 health dangers hepatitis B can put patients at risk for, identify why the homeless population is at a higher risk for hepatitis B, and discuss treatment for those with hepatitis B. Please stop now to take the pre-test to assess your prior knowledge about the homeless community and the hepatitis B virus, as well as the vaccination. The pre-test can be assessed by clicking the link titled Pre-test in the description of the YouTube video. So what is hepatitis B? The hepatitis B virus, also called HBV, is an infection of the liver. It can create an acute or chronic infection. Acute infections can sometimes be asymptomatic. Chronic HBV can cause serious issues such as cirrhosis, end-stage liver disease, liver cancer, and even death. Symptoms of acute HBV can include fever, lethargy, nausea, vomiting, abdominal pain, jaundice, decreased appetite, and joint pain. So when should a person get vaccinated for hepatitis B? Honestly, hepatitis B is the very first vaccine given to newborns. We give hepatitis B even on the very first day of life. It's a 3 series, and if you follow the series, the CDC recommends first or second day of life, 1 to 2 months after that, and then 4 months after the second. So that means by 6 months of age, you can be fully vaccinated for the hepatitis B virus. Without health care, infants, children, and adults are unable to receive basic health preventions such as vaccines. One of the most important vaccines from day of birth is the hepatitis B vaccine. Honestly, we try to make sure that infant doesn't leave the hospital without the vaccine. It's super, super important. Because without this vaccine, there is serious risk for a preventable disease that we can't avoid. There are 3 basic ways that hepatitis B is spread. It's going to be through blood, semen, and bodily fluids. So any contact with liquid bodily fluids, vaginal fluids, oral fluids, things of that sort are going to be a way that you can spread hepatitis B. That being said, needles for IV drug use are a big way to spread because of the bodily fluid through the blood that's passed on. Unfortunately, the homeless population does not have the proper means to be able to afford their drug habits that tend to be higher in this population. Therefore, they reuse needles, share needles, hold on to needles, And unfortunately, that's a major way that it's spread through this community. The other, as we said, vaginal fluids, the other thing to think about is mother to baby. So that's something that can be spread during birth if we're not aware that mother's positive for hepatitis B. So as we talked a little bit earlier about what chronic hepatitis B can cause, this is really what the patients can be at risk for, are these some of these more chronic issues. That can be liver damage, liver failure, end-stage liver disease, liver cancer, cirrhosis, and any one of these liver problems is very serious and can cause death. That's why it's so important to get vaccinated when you're this cute little tiny baby. Doesn't even know what a vaccine is yet. He's questioning it though. Okay, so we're talking about hepatitis B, the virus, the vaccine, but why is it that the homeless population is at a higher risk for hepatitis B? As stated in the project my team put together, many homeless people are victims of mental illness, substance abuse, increased housing expenses, and lack of access to education and healthcare. This lack of healthcare access leaves them at an extremely high risk for many diseases and illnesses. Without healthcare, infants, children, and adults are unable to receive the basic health prevention that they need, such as vaccines. In a recent study of 534 homeless adults from Los Angeles, it was found that the prevalence of HBV was nearly 10 times higher than that of the general population, with opioid dependence and needle sharing being the most common vessel of exposure. Contacts such as sharing needles and sexual contact are also ways that we talked about hepatitis can be passed from one to another. As we discussed, substance abuse is common among the homeless population, and as they lack the income to sustain their substance habits, they tend to share and save needles to decrease costs. People at risk for hepatitis B also include unprotected sexually active people, people who are not in monogamous relationships and have multiple sex partners, and men who have sex with men. The homeless population is trying to survive day-to-day difficulties. They are trying to find some sort of food and shelter to keep themselves and their families alive. They do not have access to or income for sexual protection. So if hepatitis B is contracted, the primary focus is going to be antiviral or adjuvant therapy as treatment. For those with chronic infections, the risk of more serious health issues has increased. The purpose of therapy for chronic hepatitis is going to include reduction of inflammation of the liver, prevention of liver failure, cirrhosis, and reducing the risk of liver cancer. There's lifestyle changes that can help with this, but also antiviral oral medications such as tenofovir, I can never say that, sorry, or entecavir, and injectable viral medications such as interferon. There is no cure for hepatitis B. These are treatments, and they are lifetime therapies. So that means this is something you'll never be in remission for. You will continue to have to use those preventative actions and take the antiviral medications to survive. Thank you for watching the presentation. Please take the post-test to gauge how much you've learned about this population at risk and why they are at higher risk for hepatitis B virus, and why we can really focus on helping this population at risk get vaccinated at the very beginning of life. Thanks so much for listening.